Thanks for coming to chat today. And really, the first thing is if you can just tell us a little bit about who you are and where you're based.
Okay. So I'm Rob Horne. I'm Professor of Behavioural Medicine at University College London and an NIHR Senior Investigator. And my interests are in how we can understand how we make treatments more effective and efficient by understanding the psychological and behavioural factors that influence why we get ill and how we respond to treatment. So a lot of my interests are in, why someone may take or not take a treatment, and what it boils down to is helping people to get the best from effective treatments.
So in terms of your role within AUKCAR, and I suppose as the centre develops, how do you think that will help you in terms of your research interests?
Well, I think it's more about how the research interests can help the centre to conduct work which is going to be transformative in terms of how we can help people living with asthma. And I think how it does that is we just look at the statistics, okay? There was a recent national review of asthma deaths conducted by Royal College of Physicians. And what that showed is really quite astounding and very distressing figures. 1,000 people die from asthma in the UK. And it's estimated over 90% of those deaths are preventable. Okay, the other startling figure that comes out is 55% of those deaths occurred in people who are not kind of being treated for severe, unresponsive asthma. They appear to almost come from nowhere, And if you combine those statistics with the fact that we have effective treatments for asthma, that's kind of a gap that we have to close. And so one of my key interests is the issue of non-adherence. We know that across long-term conditions, including asthma, about a half or more of prescribed medicines are not taken. And it's trying to understand that from the patient's perspective, taking a no-blame approach and looking at why these medicines aren't taken. And when you do that, one of the key factors that emerges is actually two reasons people can't. It's difficult, they can't use the inhalers properly, they can't remember to take it. Those are important factors. But also a very big issue is the role of patients' beliefs, and what we think about our illness and our treatment will influence how we use it. And increasingly through research we're coming to understand that actually when we're ill, we don't always share the same ideas as the medical model, if you like. So often, if you take asthma as an example, people will doubt that they need to take a treatment every day when their asthma appears to them to come and go. They don't feel ill all the time. So there's a kind of common sense logic not to take the treatment, even though that's mistaken. Many people have concerns about taking long-term medication, concerns about steroids, etc. So what we need to do is to develop a method for supporting patients to get the best from treatment that identifies whether they have perceptual barriers or practical barriers and provides support to target that. And that's part of what we're going to be doing in Programme 2.
That sounds really exciting.
Yeah, it is.
Is there anything else you wanted to add, Rob? I mean, I think that's really helpful to hear more about your work.
Well, that's one of the things. I mean, there are other things going on in the programme as well, which I think are very relevant. So one of them, for example, is looking at children with severe unresponsive asthma and how we can develop ways of helping them to get the best from treatment. So we're looking right across the age spectrum, and Andy Bush and Louise Fleming are leading a programme of work looking at children and young people. We're also looking at other issues as well as sort of the individual's engagement with the treatment. Things like the costs of treatment and whether having free prescriptions is a big factor in enabling better control of asthma. And also perhaps looking at how we can identify incentives, particularly for young people and adolescents, to get more engaged with their treatment. So these are all programs or parts of the program that we're developing. And another interesting question that's emerging is how we can understand side effects from treatment and how we help people to minimize and manage those. So there are a number of projects within the program, but they all knit together. The other exciting thing is how the 3 programs of research will dovetail. So, for example, in Program 1, that's led by Hilary Pinnock and Steph Taylor, they're developing a self-management intervention. Well, the adherence program that we develop in Program 2 will knit in with that, but also some of the behavioural expertise that we have in Program 2 will also feed in to Program 1 and vice versa. So the kind of programs are also cross-pollinating, if you like, which I think is a great thing about the centre.
Yes, it'll be a real learning centre, basically.
Yeah.
I thought of one other question really that I wanted to ask, because I know I'm coming from a kind of PPI background and perspective, and clearly that's going to be important as you develop your projects. If you were, I suppose, can you talk a little bit about the usefulness of that in terms of having volunteers and that kind of patient perspective in your research?
Yeah, I mean, PPI is essential to the research, so it's not like nice to have add-on, it's actually at the core of it. What I mean by that is it's not about just getting volunteers and getting people involved in the studies. It's having people who are affected by asthma involved from the very earliest stages, from the design of the study, and even from the deciding on the research topic that we major on within the program. And that's essential, because if we are developing some kind of intervention to affect behaviour change or to help people get the best from treatment, then that intervention's got to be real and co-designed with people who are affected by asthma, and not just some bright idea that, or allegedly bright idea, that we've come up with. So PPI is absolutely core, and we're working very closely with the PPI group at Asthma UK on this programme.
That's great. Well, thank you very much.
Thanks very much. Thank you.